Let's now go to identification of patterns. Let's discuss concept of pattern. Identification of patterns, Yancheng in Chinese, indicates the process of identifying the basic disharmony that underlies all clinical manifestations. This is the essence of Chinese medical diagnosis and pathology. Identifying a pattern involves discerning the underlying pattern of disharmony by considering the picture formed by all symptoms and signs. Rather than analyzing symptoms and signs one by one in trying to find a cause for them, a Western medicine does, Chinese medicine forms an overall picture taking all symptoms and signs into consideration to identify the underlying disharmony. The identification of patterns indicates the process of identifying the basic disharmony underlying the patient's clinical manifestations. Chinese medicine does not look for causes but patterns. In this respect, medicine does not look primarily for causes but patterns. Thus, when we say that a certain patient presents the pattern of deficient kidney yin, this is not the cause of the disease, which has to be looked for in the person's life, but the disharmony underlying the disease or the way the condition presents itself. Of course, in other respects, after identifying the pattern, Chinese medicine does go a step further in trying to identify a cause for the disharmony. The concept of pattern, therefore, the pattern, also called syndrome, is a picture formed by the clinical manifestations of the patient which point to the character, the site, and the pathology of the condition. The art of the identification of pattern lies in seeing the picture formed by the clinical manifestations of the patient. Here we can see the pattern of Chinese medicine or damp feet. For example, if a patient complains of poor appetite, loose stools, tiredness, weak voice, propensity to catching colds, and dislike to speak, we can identify here two patterns. The first manifesting the first three symptoms, insulin Qi deficiency and the other lung Qi deficiency. By defining the patterns as such, we are identifying the pathology, Qi deficiency, and the site of the disease, the lung, the spleen, and the lungs. Thank you for your attention.